Good afternoon, ladies and gentlemen. My name is Chase Jackson, Director of Social Action for the Omicron Sigma chapter of Phi Beta Sigma Fraternity Incorporated. In today's social action interview, we have with us Seetha Modi. She is the Director of Maternal Infant Health for the March of Dimes, and we're happy to have her on to talk about not only the March of Dimes, but the different programs and why it's important to give back, especially to a program who's done so many great things that the March of Dimes is doing. So, ladies and gentlemen, help me welcome Seetha Modi. Hi, Seetha. How are you?
Hi, everybody. Good to be here. Thanks for having me on.
Look, glad you can make it on. I know you have a busy schedule, but glad you could take the time out to be here with us.
I always have time for you guys. You're fun.
Look, as we know, March of Dimes is a proud partner of Phi Beta Sigma and vice versa. So anytime we can work together to bring information, especially health information, to Black men and women, especially about children, then we're more than happy to do
Absolutely.
so. All right, so Seetha, I want to discuss March of Dimes as a whole. So for those who may not know, why is March of Dimes so important, and why is it important to give to such a foundation?
So, actually, just a couple weeks ago, we were setting up our new Dallas office, and we're hanging up all these painting pictures that we
Mhm.
had, pulling them out of storage, and we have like Marilyn Monroe, Elvis, Lucille Ball, and a bunch of other people from the 20s that I maybe should know but didn't. I'll admit that. But it was kind of just a nice reminder of the history. Like March of Dimes started in 1938 when FDR was trying to think of what he could do around the polio epidemic. And I think back then it was called the National Foundation for Infantile Paralysis. And it's
Hmm.
interesting because the name March of Dimes came when it was like a radio host around that time had decided he was going to sell these little lapel pins for a dime a piece.
Oh
And I
wow.
love that concept of kind of the marching and everybody doing a little bit
Hmm.
and it becoming a bigger thing. And I feel like even though we've come a while for ways away from the polio epidemic, we still, that's sort of the essence of who we are, where we partner with people like chapters like you and our national service partners and key organizations to sort of build that momentum from the ground up and
I
make
like
sure
that.
things happen.
Yeah, you make that
So,
connection on the ground level. So,
yeah. These
awesome.
days we've sort of, I know, isn't that so cool? We've
Hmm.
sort of broadened our scope because we realized that we're still focused on babies, but we realized that healthy babies start with healthy moms. And so now we kind of are
Right.
looking, like you said, I'm the director of maternal and infant health. And so we're kind of looking at both ends and how we can help everyone. And so we sort of we have three main pillars. We'd like to
Hmm.
be think of ourselves as thought leaders still within the research world. So we do
Hmm.
a lot of research and kind of data analytics to get some insights. But then we don't want to just sit there and think that we're cool because we know stuff. We want to mobilize action. And so we do a lot of community awareness and public policy advocacy. And then I think our third arm, which is where you guys are probably most familiar, is where we deliver impact through our services and our programs locally. And to the second part of your question as to why it's important to give and why it's
Hmm.
important to give now, this is so important now because pregnancy related deaths have more than doubled just in the last 25 years. And now the
Wow.
US has one of the worst rates of maternal mortality in the developed world. And as far as the baby side of things, just in the hour that we're talking right now, two babies will die in the US. So
Mm.
I know that we have to do better for our families, especially for our Black moms and babies who are disproportionately impacted.
Right.
Yeah.
And look, one baby is one baby too many.
Yeah. And I
And
was like, you were one of
that's
those babies too, right, Chase? So it
yeah.
was like,
I am one of the ones that am blessed to say
yep,
that I made it.
yep,
So, and I don't take that for granted. And that is
absolutely
one of the
not.
reasons why I also give back. So,
Yeah. And I think, and it's true, like either you've been affected personally or you know
mhm,
somebody who has. And
right.
so, yeah, this is important stuff that we're working on.
Yes, agreed wholeheartedly. All right. So let's talk about how funds can be tracked locally. So for those who want to give, who have the heart to give, but want a bit more transparency, how can they track their funds locally? How can they see an impact from themselves directly?
Well, the cool thing is in 2021, March of Dimes earned GuideStar's platinum recognition for transparency. So we take
Okay.
donor accountability and being good stewards of that funding very seriously. And I think you're asking specifically, though, kind of about local impact. And I can speak to that. So last year we gave over $6,000 back to the community through our Meals That Matter program, which
Okay.
gives feeds NICU families as well as the healthcare workers. That, gosh, they've really gone through the ringer the past couple of years,
Yes,
right?
yes.
Yeah. And then we launched our brand new prenatal care group at a federally qualified health center in Dallas, the Healthy Hands Healing Ministry. I think now they go by HHM Health Group. But
Okay.
beyond our stand-on programs, I think the thing that I like the most about my job and that's the most exciting is that locally I have the flexibility to sort of determine what the needs are in our market and
Mhm.
pivot. Because when you guys were doing your campaigns a couple years ago, nobody could have planned for COVID. Nobody was like allotting for that,
Right.
right? That just kind of
Right.
hit the world by storm. But we were able to say, hey, there's a new need. When all the families went in, when all the hospitals went into lockdown,
Hmm.
the families weren't even allowed to go in and visit their babies in the NICU. And so we
Yeah.
were like, yeah, I know. And so we're like, this is not something we'd planned for. It wasn't in the strategic plan, but
Hmm.
it's happening now and we need to do something about it. And so March of Dimes was able to deliver over 45 tablets across the Metroplex to these NICUs that had the video apps, that had information on them. We have a special proprietary app, My NICU Baby, that's free. Of course, we're a nonprofit. And so we were
Okay.
able to get these resources into the NICU very quickly to address the need that we hadn't planned for. And I think that's
That's
sort of
impressive.
isn't that so cool? Like it's those types
Hmm.
of things that we're able to do on the fly. So we have sort of our national programs and the big picture things that we do as an overall organization. But at any given time, I get to look at my market and think, what are the needs that we're focusing on here? What are the immediate
Hmm.
pressing needs? And what can we do with the funds and support that we've been given to best address those needs?
Very nice. And yeah, so
Yeah.
especially in those situations, it is very important for the mothers to see their babies.
Oh my gosh.
And especially if you
Yes.
just can't be there to hold them, yeah, at least looking, making sure that you know they're okay, I would imagine would be very I'll say what soothing,
Oh my God,
soothing,
absolutely. That's
yeah,
skin to skin time and
but
everything. And I think
comforting.
depending on the hospital, mostly mothers were allowed, but it was the fathers or the grandparents or the other people who would have been able to come by and see
Hmm.
their babies otherwise, just to have that
Right,
ability for them to be able to connect in another way. It's so important. Or just to know like, oh, the baby can hear my voice and all those
right,
types of things. So I know it
yeah.
was
That
so
that
sweet to be able to do that project. We were so happy about it.
like I know others were definitely impressed and still grateful for that.
Oh, absolutely. But we were only
Very
able to
cool.
do things like that because of the funding from you, all the funds that you guys raise. And
Hmm.
it's kind of everybody going back to what we were saying before, all those dimes, all those, every dollar coming together and making a bigger impact.
Right, every dime matters. I like it.
Yep.
All right. So let's talk now about Phi Beta Sigma's direct impact over the years, and then more specifically, Omicron Sigma chapter's impact as well.
So I will start with your chapter. So since 2010, you guys have raised $53,830. So
Wow.
isn't that
Wow.
is yeah, you guys need
Yeah.
to like just stand up. Like I don't know if you have like a little applause button on your thing, but I was like, add some sound effects for that. That's really
Like
cool.
I'll try. I'll try to add an applause track. Don't worry.
There you go. That's what I'm saying. And it's interesting because we were just talking about COVID
Mhm.
and last year we were kind of bracing. We're like, okay, everybody's been hit so hard personally and financially through
Mhm.
COVID. Times are difficult all around. We're not even having an in-person event. So we were kind of preparing across the board to have like a much lower
Yeah. For sure.
fundraising
Yeah.
total. And I
Yeah.
feel like you guys took that as a personal challenge because you raised your high, whatever your high, like, I think your highest total to date, which was like almost $9,400. So
Mhm.
I feel like you guys took that to the next level. The National March for Babies recap, we've raised nearly $27 million in more than 114 communities across the country with 160,000 partners and supporters.
Wow.
Yeah, so thanks to you guys, we're reaching 4 million babies, 19 million women, over 150 legislatures, and thousands of moms to be. You guys have
I
been
see the
partners with
trend.
us since 2013. And like I said, even the same thing, we were thinking that 2019, 2020, 2021,
Mhm.
we were like bracing for our lowest year yet, and you guys just blew it out of the water nationally with $303,000 across the board. So that is
Wow.
isn't that
Astounding.
phenomenal?
Yes.
Yes. So I know that little by little, we're doing really a lot of really great work together. Are any of these individuals from our market?
Yes. So Cameron Shaw is actually my chapter brother and former president.
Oh, really? Oh, excellent. Well, then I
Yes.
can say the top 5 fundraisers nationally are represented here. And I think we can see that Cameron from our very own chapter is leading the force. So we
Right.
have the top fundraiser across the nation in our chapter. So that's
Right.
pretty exciting, right?
Yes. Shout out to Omicron Sigma. Thank you, Cameron. Yes.
Woohoo, go Cameron.
All right. That's really
And then
amazing.
you can see that your chapter total last year
Mhm.
is the 3rd highest nationally.
It is. Wow.
Yeah. And then this year, I kind of switching around a little bit. I think your goal for March for Babies again is 300,000. Yep. So here's our challenge is to raise more than Sigma Gamma Rho. So
Right.
we'll see.
The
Like
blue.
I've got my blue and white on today. I don't know if you can tell through the screen, but the
But
gold earrings.
thank you for the
Yes.
support. Yeah. So
Yes.
yeah, the blue,
I'm
white, and
cheering for you
gold
guys.
challenge. Thank you.
Yes.
Thank you.
So I don't know. I feel like you guys have you've met the challenge and gone beyond the last several times. So I'm excited to see what you all do this year. And then, so this year we're excited that we're partnering with a logistics company and we're kind of elevating the experience. I feel like you guys have been taking things to the next level. And so we wanted to
Mhm.
try to keep up with you. And we are taking our March for Babies to the next level as well. We're going to have all these different tents and a baby block. We don't have all the pictures. We're going to have this huge purple throne where you guys get to sit on, like the throne of motherhood, and you guys can take photos there. We have photo ops, but we're also obviously we're going to have a remembrance area for the babies that we've
Mhm.
lost, NICU
Right.
information, mission connections, just all like everything and anything you want to know about advocacy, how to get involved in what we're doing.
Mhm.
We are ready for you guys. And so it's going to be a really great event. The
Very
Dallas
nice.
event, the Fort Worth event is first on May 7th at
Mhm.
Panther Island Pavilion at 8:30, and the Dallas event is
Mhm.
at Trinity Groves on May 14th, also at 8:30. So
Right.
whichever part of the Metroplex you're in, pick your event and please come out. You guys did all the hard work in raising the funds. I feel like you got to make it to the party as well, right?
Right.
Yes,
Very true. Very true. Okay.
that's okay. So I guess what I will say about becoming a dad is we're very proud to partner with you guys on this. It was actually our first, I think that's how we started partnering with Phi Beta
Mhm.
Sigma, if I understand correctly, was around this. And it's been going on since the 80s. So I think we've been doing this for collectively for over 40 years, which is really
Mhm.
nice. And the program itself, I got to do it for the first time actually with you last year.
Yep.
And it's broken up into 4 modules. So we talked to current dads, prospective dads, a little bit
Mhm.
about before,
Mhm.
during the pregnancy, the labor component, and then
Mhm.
afterwards, because each one of those stages has so many different things to think about. And while I said we focus on moms and babies, we realize that
Mhm.
as having strong babies starts with healthy moms, but we have to think
Right.
about the way you have a
The
healthy
dad.
mom is the
Mhm.
people in the village that's supporting her as well. And that's why
Right.
it's
Right.
interesting that we started with this very specific thing of polio and kids with polio. And now
Mhm.
we're slowly kind of taking that systems approach to even how we think and work at the March of Dimes, with realizing that everything's connected and the best way to make a larger impact is to
Mhm.
think about not just the moms and the babies, but the communities and the support systems and the
Right.
resources that they have around them.
And more specifically, the fathers as well. So the father
Absolutely.
is that supporting pillar as well. So
Yes.
moms have a hard time, but fathers do too. So we need to
Oh,
think about
believe
the
me, my
dads.
husband will tell you. In
Mhm.
my own pregnancy, there was a brief period of time where I had low blood pressure and I couldn't drive, and he was
Mhm.
driving me everywhere. And he will tell you that he was doing as much work as I was, if not more.
Yep.
So said that I have my own personal pillars that I'm looking at
Right.
here locally. I the first thing I did when I came on, I started this role actually about the time that we did our last Becoming a Dad
Mhm.
seminar. I wasn't too far in, and I was relatively new to maternal and infant health in this area. And
Mhm.
because I was in a national role before this. And so the first
Right.
thing I did was sort of do a community health needs assessment. If I'm going to be able to pivot to meet the needs of my community, I kind of needed to take a
Yep.
deeper dive
Need to know.
into what
Right.
those are.
Right.
Right. And so based on that, we've come up with 5 strategies and solutions that we're working on here. And one of them is actually, we call it Beyond Labels, and it's
Mhm.
around breaking the stigma around maternal mental health and substance
Mhm.
use.
Oh
Because we
wow.
realize that a lot of times women, or especially Black women,
Mhm.
are concerned about the stigma around saying they have mental health issues, or I think there's a lot of people when they've learned to be so tough and resilient and in so many other areas of their life, there's the kind of that mentality of, oh, just like brush it off or pick yourself up by the bootstraps sort
Mhm.
of a thing.
Mhm.
And I know that's probably worked very well for you in a number of other areas in your life, but that doesn't
Mhm.
always apply to mental health because it is a biological, a fundamental brain chemistry type of issue, right? So
Right. Right.
I think letting people think of it that way and not like, oh, I'm failing or I'm not strong enough or I'm not doing what
Mhm.
I need to be doing. It's just you're going through pregnancy is a lot biologically. There's a lot going on, just even
Mhm.
outside of biologically, psychologically, the stress of being pregnant, bringing a new life into the world, navigating things while pregnant. There's a lot going on around that. And I think making it okay for moms to seek help. And
Right.
then the flip side of that is our substance use program focuses just as much on the provider side because we realize that there's a lot of stigma around within the providers even as well as the moms and or people are afraid to seek help. They're like, oh, I'm going to be judged or what will
Mhm.
people say? And so we try to work with the moms to say seek help, there's going to be people there for you, and then we work with
Right.
the provider side around that stigma and helping people view this as an addiction and saying how to have culturally sensitive care and
Mhm.
to give people the respect that they deserve when they are taking that courageous step to seek care during these times. So that is
Right.
actually one of the programs that I'm working on right now.
I like that. I like that. And yeah, so for the longest time, of course, we all know, especially in the Black community, we have had that stigma. Getting better of we don't talk about Bruno, we don't talk about mental health. So, but it's getting better, getting better.
Oh, I love that. That was funny.
Hmm. um.
Good.
So last Seetha, let's promote the March for Babies.
May 7th
May
is
7th. Yeah.
the May 7th is Fort Worth, and it's going to be
Okay.
at Panther Island Pavilion. And
Okay.
then May 14th is Dallas, and we're going to be at Trinity Grove. So
All right.
really great venues for both walks, and we're just excited to be in person and seeing everybody and
Yes. Yes.
like doing all the fun stuff again.
Yes. Yes. And look, we're all looking to, especially my chapter, looking to volunteer and be a part of the festivities. And it's always great to be a part of a walk like this and seeing others who also walk for the same cause. So,
Yes, and I would be remiss if I didn't mention that we're actually recording this during Black Maternal Health Week.
oh wow,
So
look, look at that.
yes,
Look at that.
we are on a brand for that. And like I said, this is especially important for Black women and Black babies. So I think this is
Mhm.
the time to be doing all of that. If you guys, something that anybody who's watching this can do to help support me is I'm always looking to elevate your voices and your stories.
Mhm.
Like you said, your podcast is Black Mind Chronicles, and I believe that everybody has their own experience and stories to share. When we have these types of events. Like I said, right now it's Black Maternal Health Week. Let me get
Mhm.
that out. And we have them in a few months. We have Black Maternal Mental Health Week coming up, and so
Oh,
I'm always looking for stories to share around
mhm.
just your experiences. You're a preemie. I'm sure we have lots of
Mhm.
moms who've been in the NICU, moms who've had difficulties with the system, moms who've navigated successfully and can have advice for other people to share. Like
Right.
I want to hear your stories, see what's important to you, and then elevate those to other platforms when I have opportunities to share and highlight your experiences. I want to be able to do that. Email me or we'll find a way for you guys to share your stories with me personally.
Okay.
And I just want to hear everything that you have to say about your own personal experience with prematurity, maternal mental health, and all of these issues that we're talking about, because I learned from, I feel like everybody's learning something new every day.
Mhm.
And you're right,
Yeah,
everybody has so many different experiences. I think the more I can learn about what's happening in the field and the things that are important to you, the better I'm able to do my job
right.
and support you all. So
Well, Seetha, that is all I have for you today. And once again, thank you so much for coming on and speaking on this important topic. And we're always, once again, excited to talk to one of our proud partners, and looking forward to making this March of Dimes fundraising year another great fundraising year.
absolutely.